Hi everyone, we are 5 of North Shore University Hospital's 2021 Student Nurse Externs, and we're so excited today to present to you all. My name is Catherine and I'm on 4 Cohen and I go to Boston College.
Hi, my name is Alex. I go to the University of South Carolina and I'm on the maternal child unit.
Hi guys, this is Sarah. I am on the maternal child unit and I go to Binghamton University.
Hi everyone, my name is Grace. I go to Binghamton University and this summer I was on Unit 2 DSU.
Hi, my name is Tara. I go to Sacred Heart University and this summer I was on the maternal child rotation.
The 5 pillars of Northwell Health are as follows: truly innovative, truly ambitious, truly together, truly ourselves, and truly compassionate. These 5 pillars are so important to the employees at Northwell Health and have resonated with all of us deeply with our time spent at North Shore University Hospital. However, we would like to focus our presentation on the truly compassionate pillar. This is because we have seen countless acts of compassion on our respected units, and we believe it is what sets North Shore University apart from other hospitals. One message that stuck with us throughout our externship experience first began at our New Beginnings orientation with CEO Michael Dowling. While he noted that good nurses have many admirable qualities, what truly makes a Northwell nurse is the underlying characteristic of compassion that cannot be taught. Without further ado, here is our presentation on how Northwell Health exhibits the value of truly compassionate. Hello everyone! I also had the utmost pleasure of working on the maternal child unit alongside Sarah and Tara. The nurses on labor and delivery and 3 Cats North are truly remarkable and compassionate day in and day out. I worked on 3 Cats North for the first 4 weeks at North Shore University Hospital, which dealt with patients who were antepartum, postpartum, or had a GYN ailment. I would like to discuss one of my antepartum patients. She had ruptured her membranes at 29 weeks and 5 days, which is a little early for a pregnant mom to have broken her water. This meant that, due to the risk of infection, she had to be on antibiotics and stay in the hospital until she was ready for childbirth around 34 to 35 weeks. She was anxious due to having to stay in the hospital for such an elongated period of time and saddened because that meant she had to cancel her baby shower. My nurse and I understood her feelings and always showed compassion to her situation. We sat with her and her husband and talked about happy times and the anticipation for her baby boy to be born. We knew that it must be lonely to have to be penned up in a hospital for weeks on end. This made us spend extra time in her room when giving medications or assessing her, and we went in to check on her around every 30 minutes. By doing this, it was noticeable how much better she was feeling. She was excited every day and felt relief when she saw Christy and I were taking care of her for the day. I feel that Christy showed true compassion with this patient because she took so much time out of her busy days with 3 Cats North to talk about the fire department with her husband, to talk about baby names with the patient, and to learn so much about this woman while at North Shore University Hospital. On my last day at 3 Cats North, she was my patient. I had told her that I was moving over to labor and delivery, and I told her that I had hoped to see her and her baby boy when she was ready for childbirth. Ironically, as I came back from my lunch break one day on the labor and delivery unit, I ran into her husband, and we had exchanged a conversation in passing. He had thanked my preceptor Christy and I for taking such good care of his wife, and had shared that their baby was healthy as can be, and his wife was healthy as can be in the postpartum unit. It made me so happy to get that closure, and to see that his wife and baby were healthy and happy with the heartfelt, compassionate care that they had received during their time at North Shore University Hospital. I am truly so blessed to have had this experience, as well as many other unforgettable experiences at North Shore. I am inspired by my preceptors and all of the nurses at North Shore University to become the best nurse I can be, and to have as much compassion and empathy as the nurses I have worked with throughout this opportunity.
Hello everyone. This summer I had the honor of working on Unit 2 DSU, a cardiac telemetry floor that is dedicated to caring for heart failure patients and others diagnosed with various cardiovascular conditions. In my time spent at Northwell, it has been evident in every stage of my externship experience that Northwell Health possesses the drive and passion to provide the highest quality of patient care by working as a partner to build healthy local communities. One of the greatest ways that Northwell accomplishes this is by establishing a hospital environment of compassion through patient teaching. From the first day I stepped on 2DSU, it was clear that the unit embodies the Northwell pillar of truly compassionate by creating an inclusive environment that is conducive to education for patients in all stages of heart failure. When a patient is first diagnosed with heart failure, there's a large number of lifestyle changes for patients and their supporting loved ones, including new medication regimens, dietary and activity modifications, and even the use of new specialized devices. While an adjustment that size may be overwhelming for most, all the members of the healthcare team, including the dedicated providers, nurses, and floor managerial team, continuously work hard to keep patients and their family members educated, informed, and well cared for. One strong example of compassionate education that stuck out to me is with the community of LVAD patients that are shared between 2DSU and 2 Cohen. An LVAD, or a left ventricular assistive device, is a type of mechanical pump for patients with heart failure that helps pump blood forward from the ventricle to the rest of the body and requires lifelong meticulous maintenance. One day on the unit, I met a patient with an LVAD who had been admitted for PI events, meaning he had low blood flow from his LVAD appliance due to an altered medication regimen. When the patient was admitted to the unit, he was immediately greeted by a number of compassionate nurses who had cared for him in the past. With each interaction following, the patient was met with genuine concern and compassion from the nursing staff by reinforcing previous educational teachings and taking the time to understand the patient's home circumstances. Through collaboration of the direct patient care team with the dedicated case management team, the patient was able to reestablish control over his life, living with an LVAD, with more appropriate community resources to meet both his medical and financial needs. The time that is taken by each staff member on the unit to show compassion by providing individualized teachings becomes evident in the expressed confidence that patients leave the unit with, and in their long-term ability to make the necessary adjustments in their respective communities. I am truly grateful to have spent the summer watching how 2DSU embodies what it means to be truly compassionate. And moving forward in my career, I hope to utilize techniques and lessons that I have learned this summer to provide holistic and truly compassionate care to my future patients.
Like Sarah and Alex, I was fortunate to be a part of the maternal child rotation this summer and worked on both 3 Cats North and labor and delivery. For the first few weeks, I worked on 3 Cats North, where I was exposed to many different patients, including antepartum, postpartum, and GYN patients. One of the things that I took from my experience was something that Florence had said to me within the first couple of weeks. It is okay not to have all the answers. There are many resources and members of the healthcare team available to you who are willing to help. Early in the summer, I was nervous regarding the education aspect of the nurse's role, since I am still learning so much myself. However, this piece of advice helped me when my preceptor and I were caring for a 20-year-old postpartum patient who was a first-time mom. She had elected to breastfeed her baby girl, but she was having trouble with positioning and latching. My nurse and I first taught her the cross-cradle position. Because neither of us were certified in breastfeeding education, our instructions were slightly vague. We can tell she was getting a little frustrated and overwhelmed, and she was still having trouble feeding after our education. We reassured her that many mothers have difficulty breastfeeding their babies in the first few days, and that we would reach out to a lactation counselor for some extra teaching. The lactation counselor taught my patient a new way to hold the baby called the football hold, which she found to be a lot more comfortable. She also used a very calm and slow voice while speaking with the patient, and used a lot of analogies to help explain the process. I can tell that after the lactation counselor saw my patient, she was much more comfortable with breastfeeding, and her mind was more at ease. I was even able to learn from the lactation counselor and use her teaching techniques on future patients. After lactation came to see her, my nurse and I went into our patient's room to see if she had any further questions. She expressed that she felt more confident in her ability to breastfeed her baby girl. Because this patient was my age, it was easy for me to put myself in her shoes and empathize with her and her situation. I recognized that she would need some more assistance at the beginning since it is all brand new for her. I knew that if I was in the same position, I would be just as nervous and want all the help I could get. Since our initial teaching was not beneficial to our patient, we sought out some extra help and used it as a learning opportunity so that we could help future patients in a similar situation. This experience showed me that you can still show compassion and empathy by knowing when to advocate for your patient and consult others to better their quality of care. I believe that being able to understand what your patient is experiencing and utilizing every resource to help them demonstrates the compassionate care that all members of the North Shore University Hospital healthcare team give their patients every day.
This summer, I had the opportunity to work alongside such an inspiring, knowledgeable, and compassionate group of Northwell Health professionals on Fort Cohen. Fort Cohen is a neurology unit that has a dedicated stroke unit as well as an epilepsy monitoring unit in addition to general neurology patients. I interacted with a wide variety of patients such as those with terminal glioblastomas, those with an epilepsy disorder, and those recovering from strokes. With many of these patients facing severe deficits as well as altered qualities of life due to their condition, I was challenged to care for these patients with the utmost compassion so as to bring some comfort to patients in such trying times. Throughout the summer, my preceptor inspired me to be authentically compassionate every time I stepped inside North Shore University Hospital. What I admire about my preceptor, and I think this is a reflection of her commitment to being truly compassionate, is the amount of time she spends with her patients. My preceptor, Christina, consistently makes a difference in her patients' experiences by maximizing the amount of time she spends with each patient. She often sacrifices a lunch break and stays after her shift charting so that she can dedicate the extra minutes to be spent face-to-face with her patient. With the advent of newer medical technology such as online medical records is certainly helpful, I think at times it can consequently decrease the amount of time medical professionals can spend with patients. This, however, is not the case with Christina. Whether it's pulling over a chair to hear about a patient's job, or combing a patient's hair, or answering tens of questions from a worried patient's family, Christina's genuine consideration for her patients ultimately drives her to spend as much time as possible with each of them. In turn, she is able to identify each of her patients' specific needs. The COVID-19 pandemic left many patients alone in their hospital beds, left without the possibility of seeing friends or family members. As the hospital policy has shifted to allow for 2 visitors, still, some patients aren't able to have any. In spending long periods of time in her patient's room, Christina took on the added role of family member or friend, really going above and beyond to ensure that patients felt comfortable. One specific patient experience that struck me was when Christina spoke with a nonverbal patient who was suffering from a glioblastoma and was pending home hospice. Despite getting no responses from the patient, Christina continued to talk to him about anything and everything. This really struck me because she treated him with such respect and was really trying to make him feel as comfortable as possible despite his inability to speak. She didn't abbreviate her questions or education because he could not respond. She did not assume he could not understand just because he could no longer speak. Rather, she conversed with him every time we entered the room, demonstrating her attentiveness and compassion. From my initial shift with Christina, it was evident how compassionate she was toward her patients and towards her coworkers. Being able to work alongside her this summer was really formative for me, and seeing her be so present with her patients was really inspiring and just illustrates the dedication that Northwell Health nurses put forth each day.
I had the pleasure of working on the maternal child unit during these past 7 weeks. For the 4 of us that are there, we got the opportunity to work both on the labor and delivery floor and 3 Cats North, which is the high-risk maternity unit. Since I was on the labor and delivery floor for a longer period of time, I would like to shed some light on how truly compassionate the nurses are to their patients and families on this floor. Throughout my whole time working with my preceptor, I witnessed how much effort is put into making sure each woman and her support system is made to feel that they are the only ones being cared for, even if there are 10 or more babies being born on the floor. My specific story has to do with a young couple who had a heartbreaking story. The mother was a G6P4, which means that she has had 6 pregnancies, including the current one, but only 4 living children. When I first got report on this patient, the numbers did not really strike me in any way. It is quite common to see a number discrepancy because of miscarriage or other event to end a pregnancy. However, the nurse told me that this family experienced the death of their firstborn child when he was 3 years old due to severe sepsis from group beta strep. Unfortunately, despite treating the mom with antibiotics, the baby became infected and it was a very severe case. When my nurse and I walked into the room, the mom was already 8 centimeters dilated. That meant that the baby was coming soon. I could see the fear in her eyes and she verbalized how scared she was. Even though she had had 4 other healthy children, the fear of something going terribly wrong was still there. I sat down with her, held her hand, and told her that she could do this. We would all be by her side when she was pushing, supporting her. Although I could not say that everything would be fine because I truly didn't know, I tried to calm her down. My nurse tried to ease her mind by telling her that peds and the NICU would be called in as soon as she started pushing in the event that there was an emergency. As she pushed, we cheered her on, and my preceptor coached her through the whole thing. There were times when she verbalized that she was terrified or that she didn't think she could do it, but we were there by her side the whole time telling her how amazing she was and how lucky the baby was to have such a strong mom. She ended up having a healthy baby boy, her 6th son. Through this experience, I learned how truly special the nurses are at this hospital. The mom and dad said how thankful they were to have us by their side, and that made my heart so happy to know that my preceptor and I will forever have an impact on this couple's lives.
This 8-week externship program has had an impact on all of our academic and personal developments. Although each of our experiences have looked a little different, we were all able to grasp the importance of being compassionate. The Northwell Health value of being truly compassionate is really the essence of nursing, passionately providing patient-centered care so as to promote wellness. It was remarkable to witness North Shore University hospital nurses go above and beyond every day for their patients. As patients face hardships and struggles, we, as nurses, have the power to empathize with them and offer them support in times of need. We are inspired by all of North Shore University Hospital's nurses and hope to exemplify their display of compassion.